In 1952, a 19-year-old man was admitted to hospital in Italy. Since being afflicted by a high fever for a week at the age of 3, this patient displayed worsening symptoms of epilepsy characterized by frequent seizures and loss of consciousness. However, this patient had recently developed a host of new symptoms. He was now experiencing periods of hallucinations, confusion, and extreme aggression, during which he attempted to strangle his mother and crush his young brother under his feet. Tests at the hospital revealed that these episodes were accompanied by abnormal activity in the patient's temporal lobes, the portions of the brain that we depend on to respond appropriately to our surroundings. Doctors decided to treat this patient's condition by removing most of these lobes. The surgery cured some of the patient's original symptoms. However, the procedure gave rise to multiple other bizarre and confusing issues. Upon waking up from the surgery, the patient didn't recognize any of his family members or the medical staff with whom he had been interacting with daily. He treated his parents as strangers and could not differentiate between the doctors that would arrive to examine him. Additionally, the patient seemed to lack all emotion. His speech became monotonous, and he acted completely indifferent towards his friends and family. This patient would make no gestures, no facial expressions while communicating. He would ask questions about when he could have meals or when he could go home, but his reaction to the answers would be completely emotionless. The patient would also become fixated with every new object or stimulus introduced into his surroundings. He would immediately approach any new person with the same set of elementary questions, but would only interact with them for a few minutes before becoming distracted by something else. During these frequent bursts of fascination, it was almost impossible to draw his attention away from his fixation. The patient also suffered from severe amnesia, completely forgetting about people and objects that he was not exposed to continuously. Finally, the patient displayed an insatiable appetite. At each meal, he would eat 4 to 5 times more than the average person, and he would ask for more food within 15 minutes of finishing these massive meals. At first, doctors were perplexed by this complex combination of symptoms, but they would soon make a connection between these symptoms and experiments that had been performed 20 years earlier on rhesus monkeys. This is the story of Kluver-Bucy Syndrome, a condition that rewires the brain and completely changes a person's fundamental personality. In the 1930s, a psychologist, Heinrich Kluver, and a neurosurgeon, Paul Bucy, were working to understand the function of mescaline, the hallucinogenic compound found in peyote. The scientists believed that this compound might function by manipulating activity within the brain's temporal lobes. To test this hypothesis, the scientists performed surgery on rhesus monkeys in which they removed the primate's temporal lobes. What they observed after this surgery was a strange combination of symptoms that the pair described as the most striking behavioral changes ever produced in animals. Following the surgery, these monkeys displayed psychic blindness, described as an inability to recognize familiar objects. Their reaction to stimuli, especially those that would usually elicit a fear or anger response, was also significantly muted. Additionally, they demonstrated an unusual and intense fascination with all objects in their environment. They also suffered from severe amnesia and frequently ate inappropriate objects. The scientists conducting this study would go on to publish a report designating this combination of symptoms as a new syndrome that would take on their namesake, Kluver-Bucy Syndrome. It was this report that the doctors in Italy would draw connections to in the case of the 19-year-old patient whose temporal lobes had been removed. This was the first confirmed case of Kluver-Bucy syndrome in humans, and it was also one of the most accurate replications of Kluver and Bucy's rhesus monkey experiments in humans to date. Studies have shown that men are more susceptible to this syndrome, representing over 70% of cases. Additionally, those that experience brain damage earlier in life seem more likely to develop this condition, with the average Kluver-Bucy patient being just 25. Confirmed cases of this syndrome are extremely rare, though. Furthermore, most confirmed cases only include a subset of the symptoms originally described by Kluver and Bucy. Clinical practice generally requires the confirmation of at least 3 associated symptoms before a diagnosis of Kluver-Bucy syndrome can be made. This prevalence of partial syndrome diagnoses is likely because the majority of confirmed cases have resulted from natural causes rather than a deliberate removal of the patient's temporal lobes. One of the extremely rare cases of Kluver-Bucy syndrome that displayed all of the condition's symptoms while also resulting from a natural cause occurred in the 1970s. A 20-year-old man in Philadelphia, Pennsylvania, began to suffer bouts of seizures, confusion, nausea, and fever. Doctors were initially confused by these symptoms. Although these are hallmarks of neuronal disease, neither brain damage nor infection could be detected. 2 months later, the patient's condition worsened. He lost all emotion in his facial expression and was unable to communicate effectively through speech. He reacted minimally to attempts to gain his attention, and he would spend hours staring at the television with no facial expressions or reactions to what he was watching. Doctors performed additional tests and detected defects in the patient's temporal lobes, accompanied by decreased activity in these parts of his brain. Upon discovering this likely cause of the patient's symptoms, doctors attempted to perform a detailed analysis of the patient's psychological state. The patient was easily distracted by all objects and people in his field of view. He was also suffering from severe memory loss, demonstrated by a lack of ability to remember or recognize his family members or the medical staff that he worked with daily. He was also unable to recognize a broad range of common objects, treating them as though he had never seen them before in his life and having no understanding of their intended use. He would often try to smell these objects and place them in his mouth. Sometimes the patient even tried to obsessively eat inappropriate objects. At mealtimes, he would attempt to eat plastic wrappers with his food. He was also caught attempting to eat ink, dog food, and cleaning supplies in his hospital room. Doctors ultimately concluded that the likely cause of this patient's condition was a previous viral infection that caused severe damage to the temporal lobes. Later analyses of this case have suggested that this patient's Kluver-Bucy syndrome was caused by an infection of the patient's brain by the herpes simplex virus. Indeed, this virus has since been implicated in several cases of confirmed Kluver-Bucy syndrome. Multiple causes have been linked to cases of Kluver-Bucy syndrome, with viral infections being one of the most prevalent. These infections cause swelling and inflammation within the brain that can result in irreversible damage and give rise to this syndrome. In addition to herpes simplex viral infections, tuberculosis infections that infiltrate the brain tissue have also been linked to the development of the syndrome. Autoimmune conditions, where a patient's immune system attacks their own neuronal tissue, have also been linked to its development. Another significant cause is the existence of previous degenerative neuronal conditions. It's appeared as a secondary condition following the development of Parkinson's, Alzheimer's, and Huntington's disease, as well as epilepsy and strokes. These are all conditions that are characterized by death and degradation of brain tissue. If this damage spreads to the temporal lobes, Kluver-Bucy syndrome could develop as well. Traumatic brain injuries can also give rise to the syndrome. In these cases, the trauma is often quite extensive. This is presumably because of the widespread and severe damage necessary for development of this condition. Finally, rare cases have been observed when cancer treatment leads to the development of the syndrome. In these cases, chemotherapy or radiation was used to treat tumors within the brain. Doctors believe that this treatment can give rise to Kluver-Bucy syndrome by damaging healthy brain tissue that is located near the brain tumors. Regardless of the cause, treating the syndrome is extremely difficult. This difficulty primarily arises from the cause of the condition, since the syndrome is not caused by a change in neuronal activity that can be corrected or by a disruptive mass that can be removed. Rather, the fact that the syndrome is caused by the loss of an important part of the brain that can't be replaced leaves few viable treatment options. Very few examples of patients that have been completely cured of Kluver-Bucy syndrome have been described. These rare cases involve vital brain functions that were detected and resolved early with antiviral medications. The inflammation caused by these infections was reduced before irreversible damage could occur. However, most diagnoses are made when irreversible damage to the lobes has already taken place, leaving few available paths for treatment. Most implemented at this point are focused on controlling the symptoms rather than curing the disease. This is frequently achieved through administering anticonvulsive drugs, mood stabilizers, antidepressants, and antipsychotics. Patients can also relearn how to complete daily tasks through occupational therapy. Heinrich Kluver and Paul Bucy initially removed the temporal lobe of rhesus monkeys to understand the effect of the hallucinogenic drug mescaline. Unexpectedly, they discovered a new syndrome that would be observed in multiple patients years later. However, there was another unpredictable and dark result that arose from the experiments of Kluver and Bucy. The idea that particular regions of the brain are responsible for performing specific tasks existed before Kluver and Bucy's experiments in rhesus monkeys, but these were some of the first experiments to contribute scientific credibility to this idea. This concept has since been largely supported by countless additional studies. However, initial confirmation of this concept was not universally beneficial for the medical community. When Heinrich Kluver was presenting his findings to a group of doctors in the late 1930s, a member of the audience stood up to ask if such procedures could be implemented to treat psychiatric patients with violent tendencies. Kluver would later express that he found this question extremely disturbing, and he was right to feel this way. The doctor that asked Kluver this question was Igas Moniz, the neurosurgeon who would go on to pioneer the utilization of lobotomies as a controversial psychiatric treatment. This procedure involved disconnecting portions of the patient's frontal lobes from the rest of their brain, resulting in the patient entering a permanent childlike state. Although this procedure has been discredited, lobotomies were performed on about 80,000 people, and Dr. Moniz was awarded the 1949 Nobel Prize in Physiology or Medicine for his work. Kluver-Bucy Syndrome is a shocking condition that results in a dramatic and fundamental change in a patient's personality. Those suffering from this bizarre condition fail to recognize the people and the objects around them. They lose the ability to express any emotion, and they try to eat everything in sight. Although it's rare, the condition is devastating and is always never curable. Beyond the effects of the syndrome discovered by Kluver and Bucy, their experiments affected the long-term trajectory of psychology and neuroscience. By simply attempting to determine how a hallucinogenic compound worked, they made a discovery that impacts how mental illness is approached to this day. It just goes to show how unpredictable the consequences of our actions can sometimes be.